For my health disparities class, I love my health disparities class. I only have 20 people, and it just feels so good to be in a small classroom. My health and illness class has 50 people in it, and that is not a large class by far, but it's a different sort of conversation, and it's a different environment when you have less people. So for my health disparities class, we talked about socioeconomic status and health. So we're going to be on this section for 2 weeks, and I'm so glad that I slowed my roll and spent 2 weeks on this, because certainly what we did today, we didn't get far enough. So what we did today was we did some defining, and so we defined what social class is and what socioeconomic status is. And we looked at articles that sort of compared European, especially the UK's approach to measuring social class as opposed to the United States. Notably how the UK tends to have 5 to 6 classes, whereas the US sort of just has 3, the upper, middle, and lower. And we talked about why this is problematic in terms of how it limits our understandings of class and its relationship to health. And it's really interesting when you break down these definitions and then you do sort of cross-national comparisons, because it helps your students sort of situate themselves in the literature, situate themselves with the definitions, but also pragmatically say, hey, you know what, this is really odd. We don't really have a middle class. We do more have a working class. And again, using this sort of information makes it easier to teach across the rest of the semester. So we did a lot of defining. We talked about the difference between wealth and income. We talked about, what else did we do? The different classes. We talked about whether class affects health, right? So whether your income, your education, your occupation affects your health, which is what social causation or the cumulative inequality theory, or whether it's your health that affects your socioeconomic position, which is social selection or social drift theory. And we looked at these two competing theories that try to explain the relationship between socioeconomic status and health. And one of the things that I teach my students is that what I'm teaching you is not necessarily, right, carved in stone, brought down to you from the mountain. What I'm presenting to you is evidence and different interpretations of that evidence. I want you to do with it what you will. I just want you to have an understanding of it. And so it's really just fascinating to see them look at terms that they use in everyday conversation, or that they hear, whether it's on the television or radio. I don't know why I said radio, like people listen to the radio these days. I mean, I guess you do. I don't listen to the radio at all. But anyway, like, it's interesting to see them sort of engage these topics. So for example, I asked how many classes, you know, are in the US, and they all said 3. And then we had this conversation about how there are more classes than 3. There's the underclass, the working poor, the working class, the middle class, the upper class, the inheritance class, and how that is a better picture of class breakdowns in the United States. And then we sort of circled back and said, well, why do we have conversations about the shrinking middle class? How are most Americans in the middle class when if we look at the numbers and look at economists' work, a lot of Americans are in the working class and the working poor. So it's really interesting for us to just sort of make these connections. And my goal for them is to not only introduce them to these ideas and these topics, but to connect them, to help connect them to what they're experiencing in their daily lives, So let's see, after that, we looked at an article that started to show socioeconomic patterns in health. So this article was by Braverman, I don't know the first name, and it looked at different health outcomes. So whether or not you were sedentary, whether or not you had excellent or poor health, infant mortality, and impairments. And it was by class. So we looked at education, relative poverty, and across race. So it was this multi-dimensional sort of figure or data. And it was really interesting for them to see just how important class is to health. right? It's easy to be told that when you see the numbers, and this article was great because it had figures, it had charts. So I think it's easier to sometimes ingest large data, especially large numerical data, if you just have a picture. And so they could see clearly that the more money you had, the more education you had, the farther away from poverty you were, the better your health. And this is important because there's no gene in all rich people that guarantees better health. There's no gene in all people with low education or low income that would make them susceptible to poorer health. What we're looking at are significant differences in environment, significant differences in exposure to risk factors, significant differences in access to resources. We're looking at social differences, and these social differences are creating very real health outcomes. We looked at how African American women with 16 years of education have similar health outcomes to white women with no high school diploma. And I love this data. Well, correction. I don't love this data because it's really sad that a woman of color with a PhD has similar health outcomes to a white woman with no education. But I love it because there's this argument that we like to use in society, that if you get an education, right, if you work hard, pull yourself up by your bootstraps, do what you're supposed to do, you're going to reap the benefits. And what they don't tell you is that that really only happens if you're white. Yeah, it's like the pull yourself by your bootstraps, get an education, but be white. Because what the data tells us is that people of color can get an education, but the returns on their investment is significantly lower. And